Good morning, everybody. Welcome to today's 1 million by 1 million strategy roundtable for entrepreneurs. 1M1M, as you know, is the first and only global virtual accelerator for startups. Our mission is to help 1 million entrepreneurs reach $1 million in revenue and beyond, build $1 trillion in global GDP and 10 million jobs. And in support of that mission, we've been doing these free mentoring roundtables since 2008 fall. So this is the 392nd session of the free mentoring roundtables, and we have a milestone event coming up soon in May. We have our 400th roundtable. So, you know, exciting stuff, and it's, you know, it's been a long journey doing this with so many of you, with so many different corners of the world, and it's just fascinating to see what's happening in different parts of the world, how entrepreneurs are thinking, and how the level of sophistication is improving across the board. You know, today, information, knowledge are much more widely available, much more broadly available. Wherever you are, you can access more or less the same information because of the internet. You may not have the same network, local ecosystem, but in terms of content, there's a tremendous amount of content that you can access and learning materials that you can learn from. So it's really interesting to see how the world's entrepreneurship knowledge and skill set and sophistication is really coming up very steadily, very systematically, and it's wonderful to see that. So the event is being recorded. You will find recordings of this event as well as all other 1M1M roundtables on our YouTube channel, 1M1M Roundtables. If you're live tweeting the show today, please use hashtag 1M1M. And join us on Twitter at 1Mby1M or at Sramana. We publish a lot of interesting content across all our different social media channels. Whatever you choose to follow, one or more, you will find very, very interesting content, very educational, inspirational, informative content. So these are the call-in numbers. Remember, this is a roundtable, not a broadcast. So we want you to participate. I will put this slide back up later on in the show, and we'll do a lot of open Q&A. But so all along, all through the program, you can communicate, you can weigh in on what you're hearing, what questions may come up in your mind using the public chat. Be sure you set your chat to send to all participants. That way everyone can see what you are asking, what you are thinking, what you are weighing in on, and that's a mode of participation for the moment, and then later on in the program you can also call in and participate. So those are some of the housekeeping issues. It's my great pleasure to welcome Patricia Nakache, General Partner at Trinity Ventures. I think I pronounced Patricia a little bit in a Latin format because I'm constantly hanging out with all these people from Europe and Latin America and so forth. But Patricia is American, so I think you use the pronunciation Patricia, right?
That's right, Patricia, that's right.
Well, welcome. I've known Patricia for a long time. So it's great to hang out with you here today.
Likewise. Thank you for having me.
So, Patricia, let's start by introducing our audience to yourself as well as to Trinity, a bit of context setting. Tell us about the fund and you know what you guys have been doing, etc.
Yeah, sure. So Trinity has a long and storied history. The fund was founded 30 years ago by a gentleman named Noel Fenton, who's still a partner, though semi-retired at this point. But he founded Trinity 30 years ago. He had been the CEO of 3 venture-backed startups, and had interacted with lots of venture capitalists over those years, and had come to the point of view that he thought that he could improve on the venture model, if you will. He could build a better venture capital firm and one that was built on the types of values that he really treasured as a venture-backed CEO. An important one, which is sort of mutual respect with the entrepreneur. And so we are very, sort of culturally from our roots, a very collaborative firm, both internally and externally. A lot of teamwork amongst the partners here, no silos among, within the partnership. And also very collaborative with our entrepreneurs. We really put an emphasis on forming a partnership with our entrepreneurs. And so we are currently investing Trinity 12, so it's our 12th venture fund. It's a $400 million fund. We invest everywhere from seed stage to Series B. Our sweet spot's really Series A, but we'll do that whole spectrum. And we invest across technology sectors. I mean, our focus is early stage North America technology. And within technology, there are quite a few, different areas that we spend time on, but broadly speaking, anything within technology would be within our purview.
So, Patricia, you have been in this industry now for quite a long time and watched many of the cycles that we have gone through. Venture capital has changed. The technology industry has seen many different waves, trends, etc. What is your current analysis, and give us a little bit of historical perspective as well as your current assessment of where things are, what are the changes, and how are you and Trinity thinking about those changes?
So, yeah, I joined the venture world in the summer of 1999, so just almost at the peak of the dot-com bubble, and very quickly kind of saw that market collapse. And if any of the participants in this roundtable remember those days, and many of you may not even, entrepreneurship may not have been on your radar at all at that point, but there was like various waves, right? There was like the dot-com consumer bubble that kind of collapsed, and then it was the B2B bubble, and then it was the telecom. Actually, the huge collapse was the telecom collapse. The reason that was particularly painful for a lot of investors and entrepreneurs is that was a very capital-intensive industry. So, and then we sort of went through a fairly quiet period in the venture world, sort of that 2001 to 2003 or 4. It was relatively quiet. Actually, turns out in retrospect it would have been a great time to invest, as always turns out to be in retrospect, and a good time to start a company too. That in these lulls when there's sort of disenchantment or disillusionment. And that's actually a great time to think about starting a company because nobody else is really paying attention, and there's just less competition. And then market picked back up. Of course, in 2008 we had the housing crisis, and that definitely impacted. It was the Great Recession that definitely impacted funding activity, particularly in Silicon Valley. But then probably 2009, 2010 things have picked up, and it's been fairly positive for the past. I mean, it's been a fairly up and to the right momentum market for the past 8 years or so. Now I would say that we maybe peaked 2 years ago in terms of the froth. I think there's still a lot of capital available. That's the good news. I think, though, whereas 2 or 3 years ago, getting funding, particularly at the seed stage, was relatively easy. It's never easy, but relatively easy. I would say now there's more of this, bifurcation of the market of the haves and have-nots, and we read in the paper and read on TechCrunch and a lot about the haves. But there's probably, a larger pool of companies that are just having a harder time raising money, probably because people are sort of have a bit of a hangover from the peak 2 or 3 years ago where they probably invested very quickly, It sort of, maybe had some, realizations that some of the bets they made weren't the best ones. So anyway, I would say right now we're in a period that's relatively healthy for entrepreneurs. For venture capitalists, I'd say, there's a lot of capital out there. So it's from, I would say, relative to 19 years ago when I started in the industry, it is far more competitive for venture capitalists to invest in good opportunities. And I would say that it requires a lot more specialization than it did in the past, where venture capitalists have had to go a lot deeper and sort of build their credibility in specific areas, because there are options available for entrepreneurs, and entrepreneurs want to partner with someone who actually knows something and potentially can be value add to them in building their business. So anyway, that's a long-winded answer, Sramana, but hopefully that got at some of the things you were looking for.
And what, if you look at your deal flow in the last, let's say 15 months, the 2017 till now deal flow, what are you seeing as far as trends and highlights? Not necessarily only the ones that you've invested in, but just if you look at the deal flow, what is significant, what stands out?
Well, there are definitely themes that are way more prevalent, and I would say some of those themes are certainly, and this isn't my particular area of expertise, it's one of my partners who's our fintech partner, but we're seeing a lot more blockchain and cryptocurrency related ideas and opportunities. Certainly across sectors, there's a lot of emphasis on leveraging artificial intelligence to bring efficiency and productivity to different sectors. I would say we're probably seeing a lot more happening in the whole realm of digital health. That's an interesting area where we're seeing a lot more. I'd say in the food and beverage sector, a lot more activity happening there, which is interesting. Interesting in particular for Trinity, because we have this sort of interesting history in that, and I didn't mention this when I was talking about our history, but at the outset of Trinity, the firm actually invested in bricks and mortar retail as well as in technology, not just technology. And some of the bricks and mortar companies we invested in included, we were the first institutional investors in Starbucks, we were the institutional investors in Tangs and Jamba Juice. So we actually have a fair bit of historical sort of food and beverage, kind of traditional bricks and mortar experience. So it's been interesting to see some of these new food and beverage concepts, and we can sort of bring some interesting perspective to those. So those are some of the themes that we're seeing. There's some sectors that we have been very active in historically, and I'll pick one that I'm personally involved in, which is real estate tech, which we've been involved with since actually the dot-com days. We were the first institutional investors in a company called LoopNet, which is the first online marketplace for commercial real estate that we invested in, took that company public, and then actually did a PIPE in the public company before it was sold to CoStar. So it was a very long-term and productive relationship for us. That was our first real estate tech investment, and we've been very active in that sector over the years. But just in the past 3 years, I would say, 3 or 4 years, it's become very active across the venture landscape, and it's been interesting to see. We spend time in that sector, and I personally can spend a lot of time there just given the amount of activity going on.
And what are some examples of interesting concepts in the real estate tech space? Have you invested in some in the last year?
Yes, we've invested in a few.
Let's talk about those.
So, yeah. I mean, one that I invested in about a year ago is a company that was started by actually the former president of LoopNet. It's a company called Real Nexus, and he is creating both marketplace and workflow tools around retail real estate availability and trying to provide sort of real-time access to availability information, both in terms of what's currently available, what should be coming available, and you know, based on leases and whatnot. So that's one area that we made an investment in recently. We're investors in a company in New York called VTS, View the Space. Well, it used to be called View the Space. They shortened it to VTS, which is a CRM platform for commercial real estate. So, you know, it's actually interesting to see how some, you know, I think historically a lot of SaaS concepts were more horizontal, and now we're seeing a lot of really interesting deep vertical solutions, particularly for very large verticals, you know, real estate being one, you know, obvious one, and you know, healthcare and fintech. I mean, there's a bunch of really big, meaty verticals, and it's sort of interesting to see some of these technology solutions evolve for those verticals.
Yeah, interesting. And in terms of stage, you said you do seed Series A and Series B, your sweet spot being Series A. What is your definition of Series A? What do you like to see if you are ready to do a Series A investment? What do you like to see in the project? What kind of validation are you looking for?
Yeah, I mean, ideally we would, for Series A, ideally we would want to see some product market fit. Now, it might just be sort of an initial target market, and you know, the product roadmap might leave room for a lot of evolution and sort of expanding the market opportunity, but I think we'd at least want to see some initial product market fit. And you know, there's sort of this this kind of rule of thumb, if you will, of to get Series A funding, you need to be at $1 million in ARR. And it is true that that could be meaningful for us, but that's a bit of a blunt instrument, and it's not a hard and fast rule, because you know, we do take things into account, like what's the quality of the revenue. Meaning, you know, if it's low gross, you know, it depends on the gross margins associated with that revenue. It depends on the retention of customers. There's a lot of other metrics that are important, but that actually tie into this notion of product market fit. If it's a good, if there is a fit with a core group of customers, you're going to see you're going to see better retention. So I would say, you know, some level of product market fit is the most important, and also probably, you know, we do like to kind of see companies over time and the progress they make over time, and it's interesting to see when, you know, when companies start attracting some key management team members, that can be very meaningful as well.
And what is your definition of Series A? We are seeing a, you know, bit of a segmentation happening in the industry of people who are willing to do smaller Series A versus people who want larger Series A's, and that could vary between, you know, 1 to 3 million Series A versus 5 to 10 million Series A. What is your sweet spot or preference?
Yeah, you know, we have a fair bit of flexibility, actually. So, and we're probably more ownership oriented than we are, you know, focused on check size. I will tell you that our range of check size, there's no sort of, you know, sort of minimum, if you will. We probably, in terms of initial check, you know, as a practical matter, usually don't write initial checks greater than 12 to 15 million. That would be sort of the high side for us. Our probably median is somewhere in the $7 million range for a Series A. And I think that's a bit reflective of the fact that, you know, round sizes have just gotten bigger at every stage. You know, what used to be considered a seed, you know, what used to be considered a Series A would now be considered a seed often in terms of size. So we're pretty flexible. We can play, you know, pretty much any size round, whether it's a $3 million round or a $10 million round. And what we're more focused on is, ownership. So we look for 20% plus ownership in the investments that we make. And we typically lead or co-lead, and we typically look to take a board seat. Because our philosophy is, it isn't just about the capital, it's also about really partnering with the entrepreneur to try to make, the company as successful as we can. And, the more we've got wood behind the arrow, the more, our interests are aligned. So that's our philosophy.
And what, in terms of segments besides real estate tech, what else do you particularly like to invest in? Is healthcare IT one of your sectors?
I would say broadly, I spend a lot of my time in the consumer space, consumer-driven markets. And so that can be anything from, marketplaces to e-commerce or, online services. And so in the marketplace arena, I've had an investment theme around the sharing economy for many years, I think probably since that term evolved. And, I'm an investor in Turo, which is a peer-to-peer car rental marketplace. I'm an investor in ThredUp, was the first institutional investor there. ThredUp is a marketplace for gently used clothing. Actually, in the marketplace arena, I was also an investor in Care.com, the marketplace for services, now a public company. And actually, another theme is, for many years, in addition to the sharing economy, another investment theme for me was what I call the she economy, which is sort of, recognizing the important role of women as, as basically, kind of chief procurement officers for their households, and also as kind of very active participants in social media, which is important from a sort of customer acquisition, referral, building referral networks, et cetera. So that was one theme. So those are some of the areas that I've spent time on. I continue to think the sharing economy world is really interesting. In fact, sort of at the intersection of that and real estate are some really interesting concepts that I've been spending some time looking at, which is how do you make more efficient use of real estate? And it's sort of, a lot of these themes also coincide with an emerging consumer theme around being more experience-driven and more interested in experiences than in ownership, if you will. And we've read a lot about.
Trend right now, I think.
Exactly. And so instead of owning a car, you might take Uber and Lyft, and for day-long or multi-day trips, you might rent a car on Turo. And instead of necessarily owning your furniture, you might rent your furniture. And so that allows you to not be sort of burdened by ownership. It also allows you to change things more readily. There's less friction if you want to change things out in your life and introduce some variety to it. So there's some interesting consumer themes. One of the interesting things that I've been spending some time thinking about too is just sort of, the opportunity to build brands at this juncture, just because I think consumers, particularly younger consumers, are really, I don't feel a lot of affiliation to the larger CPG brands that are out there, and are really embracing new brands that are values-driven. In fact, actually, I was just meeting with a company, and I kind of liked how they described themselves. They're like value with values. So they're like providing values, like a better value proposition to the consumer, but wrapped in like values that can be very important, like environmental sustainability and et cetera. So anyway, I think it's been fascinating to see a lot of direct-to-consumer brands, emerge that really speak to a new generation, and frankly, often taking political stands and that it's harder for larger established brands to take because they have a very diverse customer base.
Yeah. So good segue actually into the hairy question that our industry is really grappling with, is the issue of women and entrepreneurship and bias and sexual harassment and all that. Give us some general thoughts on how you are parsing the whole world around us on those topics.
Well, you know, there are two separate topics. You know, one is sort of sexual harassment, and then the other one is sort of, you know, the lack of gender and ethnic diversity in the investing community, which translates, I think, to lower funding to those populations from an entrepreneurship level. So, you know, the sexual harassment piece, I would say, you know, thank goodness that there's been a spotlight shined on that. I mean, I personally was, you know, surprised at the depth of it. I mean, I actually lecture at Stanford Business School, and I remember when some of these stories first started coming to light a few years ago. I mean, they crescendoed, I think, in the last year, but the stories started coming out a couple of years ago, and I remember speaking to students at Stanford about it, and I was surprised at the number of women in the class who basically had their own personal stories of having been harassed, you know, in conversations with investors in sort of a power position. So I'm delighted that there's been like a spotlight shined on it, and I think a lot of that behavior, hopefully, is getting addressed, and that there are means to surface that kind of behavior more readily than I think there was in the past. And frankly, I applaud a lot of the young women who've like raised their hands very bravely and put themselves out there, because I think in the past, I think there was a little bit of an approach of, you know, I'm just gonna, this is kind of a private matter that happened to me, and I'm just gonna kind of deal with it and move on. And I think a lot of young women are bravely kind of putting themselves out there. So that's
one comment I want to you know, highlight on this is that the big difference I see in how the issue is being recorded or reported right now is people are actually naming names. That was not at all common in earlier on. Even if there were incidents reported, people were not naming names. Now they are, and I think it makes a huge difference.
Yeah, I think that's right. I think that's right. And you know, but I even as recently as the Ellen Powell trial, I mean, there were names listed there, and somehow there were no repercussions, or there didn't seem like there were as many repercussions.
But I'm sorry, Ellen Powell doesn't have a lot of credibility with me because she was sleeping with a partner at Kleiner who was a married guy. So, I mean, that's not a credible situation. That's not a sexual harassment situation.
But there were in the trial there was testimony from other people at Kleiner indicating sexual harassment situations that I thought, you know, didn't get the attention that they deserve. But anyway, so anyway, there's that whole you know, set of issues. But then there's sort of the systemic long-term issue of not of very few women in the investor community and very few you know, people of color, and then the impact of that in terms of, you know, where the dollars flow. And I think there's also been a lot of awareness built around that as well. Yeah. And I think that, you know, we're seeing a lot of hiring going on. We're seeing a lot of firms hire their first woman, which is great. And you know, some of them are being hired, you know, at the partner level, which I think is really key, because I don't think, you know, it's enough to just hire at the junior level and sort of claim you check the box, if you will.
Right. And, you know, the other question that is very relevant to this discussion is what you were talking about earlier, is women being the decision makers, the chief procurement officer, as you call them, in the household or in a lot of different categories. the buyer, the actual decision maker in the buying cycle, is the woman. And traditionally, a lot of entrepreneurs who have worked in that category have found it very difficult to get through to investors, because these investors are mostly men and they have no idea about how the psychology of that buying cycle works. And as a result, they pass, not because they don't want to invest in women, or it's just because they don't understand the business.
Yeah, I think that's right. I think that's right. It's I remember when I invested in Care.com, I remember when Sheila Marcella came in for the partner meeting, and I think it was really valuable for me to explain to my partners that at the time I was spending $300 a year just to have a backup nanny service, just to have a backup, babysitting service that I could call if my babysitter called in sick. And it was like an insurance policy. And I think it was helpful for me to have that personal experience, to be able to share it, because it made my partners realize like how mission critical childcare is to a working mother. And so I think I totally agree, which is those personal experiences that can help you sort of understand at a visceral level the potential market opportunity.
Yeah. As you remember, I did fashion as one of my companies, and in 1999, I mean, hardly anybody had any idea about what the hell that was.
Yeah, yes, that's true. I know.
So any parting comments before you head off to the audience?
I would just say that, I resonate your comments at the beginning before we started the interview, which is in some ways it's like never been a better time to be an entrepreneur in terms of the resources available and the information available. I really do think that there's, that it's not a completely level playing field, and probably never will be, but I do think that access to information and is as good as it's ever been, and resources. And so anyway, I just kind of wish everybody the best on their entrepreneurial journey, and encourage everybody to take advantage of the resources that are out there.
Well, thank you, Patricia, for participating today, and we'll be in touch.
Okay. Thanks, Sramana. Good to chat with you.
Good to chat with you as well. Folks, we'll switch to the mentoring portion of the program today. And let me just set some expectations before we jump in there. We do use this as a working session. This is, you can feel completely safe and bring your issues that you're getting stuck on to these sessions. There is no other agenda here than to help you, remove your roadblocks, brainstorm about your issues, and so forth. And it's okay if you disagree with my feedback. It's your venture. You will do whatever you want with that, with your venture. And there's one thing that you will need to keep in mind, however, which is that not all businesses can raise money, not all businesses should raise money, and raising money does not guarantee success. So that's a fact of the industry, and you need to understand the nuances of that fact, the nuances of the decision-making of what does get funded, what doesn't get funded, why, etc., to be able to make your decisions along the way. So Prashant Chopra from Foster City, California is our first presenter today. Prashant, please go on. And I will take the questions from the public chat in a moment, folks. So let's just do Prashant's presentation, and then we'll go to Q&A. Go ahead.
Thank you, Sramana, and thank you, Maureen. Thank you for enabling us. I know it's not easy, and you take time out of your busy life, so I appreciate it. So my name is Prashant, and I believe personally in two causes, which is one of the big reasons why we founded the company. We are marketing a product called Lucid Vascular. Our mission is to eliminate all uses of fluoroscopy, which is radiation, and vascular contrast from the entirety of vascular procedure suites, and which is why you see our tagline as zero fluoroscopy endovascular care. And hopefully by the time we are done with the presentation, you and the other audience would be able to understand a little bit better of what that means, because it's not easy to explain it in one slide. The problem we are addressing is ineffective and unsafe fluoroscopic guidance. And this is a global challenge. It's not particularly pertinent to US alone or Western world alone or growing economies alone. The current ways of seeing where the tools that go into our blood vessels, arteries, for example, to clean up blockages in our hearts, just to be able to see where they are, the current methods are unsafe. There is a huge rate of complications and repeat procedures between 15 to 25%. It's expensive, very expensive. It's close to $390 billion US I spend just to manage the complications alone in US per year. It's inadequate. It is, as I was saying before, 20% or so procedures fail, and this is a conservative estimate. Okay, the user is endovascular surgeons, and we are targeting large academic hospitals first as the early adopter test bed. Go ahead, please. So our solution is a portable zero fluoroscopy holographic guidance system. Our dream is to make it so portable that you can carry 2 briefcases up on the top of a hill where there is no electricity, but you get solar power. You open up both briefcases. One briefcase has a sensing system that senses where the tools are in the 3D space inside the patient. The second briefcase has the display system, which in future our dream is to make smart glasses that let you see through the patient's body. Right? And that's pretty much the gist of it. It's very ambitious, but we can show some glimpses of the prototype we've already built and are testing on animal models right now.
Wow, fascinating.
Yeah, thank you. Our go-to-market strategy, the best that we understand today, there's close to 1 million procedures, just peripheral vascular procedures, not even in the heart, that happen today in the US per year. If we target a normal hospital, not even a big hospital like Stanford, they do way more than 500 such procedures a year. But let's say if a hospital does 500 such procedures, our math, which has been validated, backed by not just user research but quantified data, says that that kind of a hospital can save close to $827,000 a year. And this is only talking about the efficiency aspects. We are not even talking about not having to bring the patients back in for repeat procedures or dialysis because their kidneys failed due to the older methods. And as I said before, early adopter endovascular surgeons, large hospitals, very concerned. This is our survey results. It's ongoing right now because surgeons typically are not trained to use radiation much. Close to 50% of the 1 million procedures in the US alone are done by surgeons. You can move on, please.
So just a quick feedback, Prashant. This slide is difficult to understand. You may want to present the slide differently.
Okay. Thank you for that feedback. The market segmentation, as you can imagine, the platform itself is very generic. As long as we can track a tool inside a body and the physician can see through the layers of the skin, you can go anywhere in the body and do a surgical procedure safely. But we are focused on peripheral arterial or peripheral vascular procedures to begin with. The available market for peripheral procedures not in the heart to begin with, guidance only, is approximately $6 billion US. And our first product, assuming we capture 100% of the procedures with this safer way of doing procedures, takes us to $1.25 billion of obtainable market segment. The trends, this is a very busy slide. I am taking a comment already. I apologize. We'll change it. But there's two things, two takeaways from this slide. Number one, the aging population in US and across the world, traditionally there's not been many ventures who are focusing on that. And it's a huge problem, not just morally, but also economically. You can see today there's about 20 million people in US alone who at a moment have a kind of vascular disease, which is expected to grow to 37 million by 2030, and there's almost an equal number of patients who actually end up getting treated for vascular diseases that are undiagnosed, right? So the numbers, that's the trend of how the patient population that needs our care is growing, and it's unsustainable. Today we are spending, as I was telling you, $392 billion just to manage this condition. You can move on if you don't have any comments, please. So just a quick brief on our technology. For us to be able to take away the X-ray, we need to be able to see what's going on inside the body. What we use is a way of intelligent imaging that's preoperative imaging before the procedure. We don't do repeat imaging. So whatever images were taken to diagnose the condition, hey, you got a blockage in RCA or a particular artery in the heart, we just use that image set, we make it deformable, using some image-based learning algorithms, and then we track our tools on a deforming model. So it's literally claiming that you are seeing a moving tissue and the tool is inside the tissue and you can trust it. So that's the whole foundation of the technology. So
you were using imaging, imaging data that has been taken through from the diagnostic stage.
Yes. Yes.
And assuming that that is constant while the surgeon is operating on the body. And how is that today? Today people are using X-rays with people. How are people doing that process today?
That's a great question. So on your first point, Sramana, we cannot assume that the images, that the body parts or our anatomy is going to stay static just as they were in a snapshot. We cannot, which is where we use some intelligence, computer intelligence, to make a deformable model which can move like a soft organ in a 3D world, but that's just not enough. We need to know where to move it to. We need to know what has happened to the body since the last scan, right? And that's where the sensing comes into the scene. Today, people use X-rays to be able to see where things have moved to, but they cannot see soft tissue very well. They can only see hard things like their tools. With our technology, we track both the tool and the tissue. So let's say you are operating in the heart. We are able to sense parts of the heart as they're changing without using X-ray during the procedure and show it to you. And at the same time, we also know where the tool is. In that moving heart, we show it to you as well at 15 to 20 frames per second, right? And so the entire premise of our technology is we need to be able to track what's happened since the scan without X-ray. I don't know if that answered your question. Please ask more if you need to.
Let's keep going for the moment. We'll come back to it. Let's finish your presentation.
Okay. Got it. So here's the doers, the team that has their nails dirty right now. Dr. Joshi is our chief clinical advisor and a private investor because we are a pre-seed funded company so far. That's me, who is a technical founder with about 10 years of experience working in surgical robotics industry. And there's Miss Linda Chan, who's wonderfully heading our product, who's connecting who's basically helping us validate the product market fit. Right. And then we have the questions for you and any of the specialists you might have on panel.
So we'll do your questions. I think the first issue is very key. So our expertise, by the way, I'll just be completely upfront with you, is not in medical devices or biotechnology at all. For precisely this reason, FDA is a requirement. For something like this to go to market, FDA is a requirement. They will never let you get to market without FDA. So then how do you show traction? We don't have necessarily the expertise to know how these businesses get funded in the biotechnology space. There is a way, because there's a lot of biotechnology companies do get funded, but I can't say that we have the expertise on that topic. So, and you're going to need to go to, you say traditional VC investment. What do you call traditional VC investment? There is a class of VCs that specifically invest in medical technologies, medical devices, biotechnology, etc., that don't operate like the information technology industry, where in information technology industry, no one will invest in anything, even seed stage, unless you have product market fit. That's the reality. But your industry is not like that, because your industry traditionally for the longest time has had to grapple with the issue of FDA approval and the fact that, you know, these new innovations have to somehow come to market and need financing, but also need runway to get to FDA approval. FDA approvals take time, etc. So, so I don't know. I have no idea how these things go, and I don't think these are necessarily as easy to bootstrap. So, so I mean, unfortunately, our methodology, which is bootstrap capital efficient startups, do not apply to your industry. And our methodology of getting to product market fit using you know, various kinds of bootstrapping, none of those would apply to this particular scenario. So, so my recommendation as a next step to you would be to surround yourself with people who have experience of biotech financing. And be careful to distinguish between healthcare IT and biotech. And you know, so there's the class of companies that you would be more compatible with are biotech, bioinstrumentation, life sciences, medical devices, that category. Healthcare IT operates like us. Healthcare IT doesn't require FDA necessarily. Depends, sometimes does, but a lot of healthcare IT doesn't require FDA, and we can handle those in our core methodology. But you need to find a bunch of people, and there are lots of people like that in the industry. So you can you know, you can connect with them and get input from them. But that's my guidance. Is to you. You have to find a different set of mentors who are experts in that type of financing.
Got it. Can I ask one question, Sramana, on your feedback? You have, I mean, you obviously have tremendous experience. You've been through entrepreneurship yourself, and now you're helping people like us. Is there any generic advice on how to best and most efficiently find a product market fit? If you ignore the medical device aspect, what would you say generically?
So one methodology that we use that will apply in your industry, which is, it's a good question that you asked me, a very good question, that will apply is the customer immersion, right? So the people who are going to be your eventual customers, it doesn't hurt to go talk to them and explain to them what you are doing. So you could be talking to 100, this is something we do routinely with our companies, is even before they build anything, even before they write a line of code, we send them to go talk to as many customers as possible. We recommend that you spend, you know, as much time as possible, and if you can bring those, that feedback, and this is something then you can take to investors like, look, we've talked to 100, you know, hospitals or surgeons and so forth, and this is what they say, this is what they think is their issue, these are the questions they're getting, this is how we're going to address the pushbacks and so forth. That customer immersion is going to be considered most likely validation in your industry. At least if I were investing in your space, that is what I would be looking for.
That's brilliant. Thank you. I'm so glad I got the courage to ask you that. Thank you.
Good. It's a very good question. Excellent instinct. All right. Well, I wish you all the best, Prashant. We will tackle your questions. You sent me a private question as well. Actually, I may even do that right now. So let me see. Your question to me and Patricia was, what metrics would you use to assess product market validation fit in medical healthcare sector where regulatory approval is a necessary hurdle to acquiring customers? So we just discussed that question. You've got your answer already.
Thank you.
Yeah. And then Karen Weathers, you sent a question, do you invest in consumer products to Patricia? Well, Yes, I think Trinity does invest in consumer products, but it really depends. They definitely invest in consumer businesses. So it's a question of how your consumer product is going to market. Is it going to market through an e-commerce model? Is it going to, how is that product going to market? What is that product? What is the time of the product, etc. So Karen, if you want to come and pitch your idea or your business here in one of the subsequent presentations, I'll be happy to answer, or you're welcome to dial into the call in a few minutes, and we can also talk through your question in more detail. Samir Penkar is commenting from Minneapolis. They have some large medical device companies here in the Twin Cities. Okay. So folks, I'm going to spend a few minutes explaining how to use 1 million by 1 million and then go to Q&A. So line up your questions, ask your questions in public chat, and be prepared to dial in as well if you'd like to dial in and actually converse with me. One request from us to you is please bring serious entrepreneurs into 1M1M if you like what we are doing here. We've been doing this for a long time. We've helped a lot of entrepreneurs, and what we're looking for are serious entrepreneurs who understand that this is going to be a long journey. Companies are not built overnight. It takes a long time to build companies. So you're going to 1 million by 1 million, 1mby1m.com for resources. You'll find a blog that is chock full of interesting information, and you'll learn a lot from just following the blog, and that's free. The Entrepreneur Journeys book series, there are 12 volumes of it. You can learn different topics of entrepreneurship through that process. So whether it's different methods of bootstrapping, whether it's how to build a billion-dollar unicorn company, cloud computing, e-commerce, et cetera, you'll find tons of different books on each of those topics. And each of these books have 12 to 16 case studies. So the books are both analysis, but also case studies where you actually hear from entrepreneurs who are operating with that principle and how they have done it, how they have put one foot before the other. That is really where we have excelled in 1 million by 1 million, is bringing you these incredible stories of how people have put one foot before the other. Okay, now these roundtables happen every week. We have tens of thousands of people attending these roundtables over time. Our full acceleration program is 1M1M Premium, and that costs $1,000 in annual membership fee. We offer you extensive methodology guidance. We have an online curriculum that has over 300 hours worth of material. We have intense help in business development. We do this kind of strategy consulting in our private roundtables for premium members only. And we also help you with financing and media relations. The 1M1M self-assessment on the website is something that we recommend you look into. It's a set of questions that we want you to ask yourselves about your business. And it will help you formulate a strategic plan for your business. If you get stuck on any methodology issue, go to 1M1M Basic and learn the methodology. It's what we were discussing earlier. The resources available from wherever you are in the world of getting more sophisticated from a methodology point of view are immense right now. And 1 million by 1 million is one of the key resources in that equation where you can easily become a much more sophisticated entrepreneur just through the content. So those are, some of the points. You can go dig in the website. There's lots of information about what to expect from premium, from basic. There's a lot of videos, video FAQs, etc. The curriculum is described in a lot of detail. The curriculum is case studies and video lectures based. We have over 800 case studies of successful entrepreneurs, and these include 50+ unicorns, 400+ venture funded companies, 350+ bootstrapped companies. And these entrepreneurs have very generously come and explained how they've put one foot before the other, and detailed conversations on how they've done it. So that knowledge is immensely valuable. If you go through case study after case study of people, how they've done it, you're going to develop confidence in the methodology, as well as you'll develop confidence on your own ability to build something from scratch. All these people have to build things from scratch, and that's something that gives you confidence and gives you methodology on how to do it yourself. Our methodology is lean, capital efficient, bootstrap startups. So you will have to follow the principle of bootstrap first, raise money later, or bootstrap all the way, whichever way you want to do it. That's pretty much it. Our next few free roundtables are basically all of April, 5, 12, 18, and 26. And we also have these in-person rendezvous, April 4th, 11th, 18th, and 25th. And that's it. We're open for Q&A right now, so I will start picking up questions from the public chat, and we also are open for you to dial in if you like. Ankit Raj is asking, what is your opinion about blockchain and especially cryptocurrency? Well, we are seeing a lot of blockchain ideas right now. Some of them don't make sense. Some of them do. Cryptocurrency is another level beyond that. Again, a lot of it is going to implode, I think. There will be cryptocurrency in our future. Which ones are going to survive, don't know. So it's in a highly speculative state right now, very active. It reminds me a bit of the .com, early days of .com in the 98, 99, 2000 time frame, what we were talking about with Patricia, that market collapsed like in a thud, really, in about 2000, 2001. But it was incredibly active, poorly understood. And that's where we are with blockchain and cryptocurrency right now, but it will evolve, it will mature, and we will get to better understanding. We will get to the ideas and the methodologies that actually do scale and do make sense. Any other questions? Please feel free to type into public chat or dial in. Let me introduce you also to Irina Patterson, who will answer your questions about the 1M1M program. And any questions further, we're happy to address. Any questions, folks? By the way, feel free to also introduce yourselves. There are a lot of people in the room. This is a very nice time to introduce yourselves. Who are you? Where are you dialing from? What project are you working on? What kind of issues are you dealing with? This is also a good networking session. Anybody? Questions, comments, introductions?
Hi, Sramana. This is Prashant again. Can I jump in with one question? I don't want to miss out the opportunity.
Certainly. You can, you know, as long as nobody else is asking questions, you can jump in with as many questions as you want.
Thank you. I'll be quick. What is the #1 thing that you look for in a startup mission, regardless of whether you're looking at them as an investor or not? Like, what is the one thing, when you hear the word startup, what is the one thing that you think is core to being a startup team? Thank you.
So, you know, our philosophy is entrepreneurship equals customers, revenues, and profits. Financing is optional, exit is optional. So if you actually dissect that equation, entrepreneurship equals customers, revenues, and profits, that means you need people, you need customers whose problem you solve and who are willing to pay for you to solve that problem. So the problem needs to be acute enough. We have this, kind of truism in the industry: is it a painkiller or a vitamin? Painkiller is something people are willing to pay for urgently, whereas, you know, vitamins people may or may not be willing to take.
It's a great analogy.
So that's one key thing. So the real issue is, can you monetize your solution? Can you actually get interest from a customer who has a pain and get them to pay for it, which addresses the customer and the revenue piece. And then comes the profit piece, which is, do you have the economics in your business that will result in a profitable business. So if you see, there is actually a lot of really bad companies out there, and some of these end up getting venture capital. They have really poor unit economics. So they're kind of doing this loss leadership campaign. They're subsidizing because they want to acquire a lot of customers, and they don't have a profitable unit economics. You can't really build a sustainable business on these kinds of practices. We don't believe in businesses like that. We only believe in businesses that have the capacity to generate profits. May not be profits right away because you are, you're trying to, become a bigger company, so you're investing in your growth and so forth. But from a unit economics point of view, you have to have profitability built into the unit economics. Even if the P&L is not profitable right away, the unit economics need to be sound.
Got it. Thank you so much. Thank you.
You're very welcome. Samir Benkar is saying, I just want to state how much I've learned through these roundtables. Thank you. It has given me develop clarity of thought and how important it is to articulate your idea well. Very good, Samir. I'm very happy to hear that. Anybody else? Any other question or comment or introduction? I'm looking for introductions. Folks, who are you? We have so many people in the room, and many of you we haven't met before. So tell us who you are, where are you joining from, and what are you working on? And by the way, Irina will be very happy to talk to you if you need to talk to somebody to make your decision about whether 1 million by 1 million is the right accelerator for you or not. Looks like we have a very shy group. So are there people in the room who are joining from Oracle? Because we have currently, as we speak, we are running this Oracle 1 million by 1 million Spring Challenge, and the applications for that are due soon. So, so I know there are a lot of people who are following these roundtables from Oracle at the moment in preparation of submitting your application for the program. If you have any questions, please feel free to ask about that program as well. Dharam Singh is introducing himself from Agile Soft Systems, software services company. They are actually, Dharam Singh is a premium member of the program, and they're a software services company that is also looking to build a product and are testing a bunch of ideas against the methodology of 1 million by 1 million. Based in Fremont Software Development Centers in India, services company pivoting towards products, bootstrapping product company with using services, which is, by the way, a tried and true methodology. If you go to the Entrepreneur Journeys book series, there's a book called Bootstrapping Using Services, and if this is a methodology that you're following or are interested in following, that methodology works great. We have success after success, both in the case studies as well as in the program itself. We are seeing huge success with this methodology. Mohan Medasani is asking, thanks, Sramana, for detailing about the 1 million by 1 million program. Today I'm here to know how roundtable discussions well, I'm just not sure I understand your question. You want to just check out how the roundtable discussions go? Yes, Mohan? Samir is introducing himself, independent consultant based in Minneapolis, currently consulting for a regional bank as a program manager. Had some ideas bubbling up, will present in 1M1M roundtable soon. Great. Samir, since you have a job, I mean, you're maybe a consulting job, but you do have a job and everything. So one thing I would strongly recommend is you maybe do 1M by 1M basic, and that is our curriculum-only program. So just do, maybe a month or a few months of 1M1M basic and get the methodology under your belt, and then present, perhaps. You can present before if you like, but I think since you have, you have a paycheck, you have money coming in, you can do this on the side. Just get your methodology training up to speed. And this is my guidance to all of you. The amount of confidence you will have once you have the methodology under your belt is going to be substantially higher than if you go in without a core methodology understanding of how to put one foot before the other. So it's a no-brainer, $99 for a month of membership to the 1M by 1M basic. If you just put in, you know, say 50 hours in 1 month to just study methodology, you will be far, far, far along. If you do, let's say, 3 months of methodology and put in, let's say, 100, 200 hours of methodology training, you will be so much further. I can't even, you know, explain how much value you're going to get out of it. Peter Esteves from Mexico City, entrepreneur. Peter, what are you working on? Dharam Singh says, by the way, I found the case studies in the curriculum enlightening. The interviews and insights are full of knowledge that is practical and hard to get unless you know these people. Entrepreneurship is a lonely journey. I wish I had joined 8 years ago. Well, we did exist 8 years ago, but just about. We launched at the end of 2010. So very happy to hear, Dharam, that you're finding it useful. Anybody else? Any other questions, comments, introductions, folks? All right, well, if you are done, then we're going to adjourn the session today. Remember, we have, you know, pretty much roundtables every week in April, and also rendezvous every week in April. So 5th April, 12th, 18th, and 26th are the roundtables. 4th, 11th, 18th, and 25th are the rendezvous at 5 p.m. PD Pacific at Cafe Boroni in Menlo Park. There are a few more comments here. How would someone working in a large company start on a new idea in terms of IP?
So we got a while to go, huh?
Is somebody trying to speak within the call? All right, Shamkant Vapsar, I'll answer your question. So, by the way, this topic is extensively addressed in the Bootstrapping with a Paycheck module of the curriculum. So if you go through 1M1M Basic and start doing the Bootstrapping with a Paycheck module, all of these details are going to be answered. But just briefly, to give you a few pointers, if you are doing something, if you're working in a large company and you're doing something that is competitive with that company, it will not work in a Bootstrapping with a Paycheck mode. So my suggestion to you then would be, you can do the curriculum, do 1M1M Basic, you can even do 1M1M Premium, but basically learn the methodology. But in terms of actually starting to code or starting to build a product, I would wait till you get out. You can validate, you can start validating your idea while you're still working and get clarity on what you're going to be building. But if you're doing something competitive with your current employer, it's better that you leave before you start building something. So that's in general. But if you're not doing anything competitive with your current employer, you can do it. You can even let them know that you're doing it, and I think it will be fine. The third point, actually, on that topic is there are a lot of companies that are doing intrapreneurship programs. So they welcome your entrepreneurial activities. So the partnership that we have with Oracle that I was just talking about, the Oracle 1M1M Challenge, that is an intrapreneurship program, and it's Oracle encouraging employees to become intrapreneurs. Karen Weathers from Los Angeles is working on a consumer product. Karen, what is the product? Would you like to discuss, or is it a stealth mode thing? Anyone else? Any other introductions, any other comments? You know what Dharam Singh just said about the interviews and insights are full of knowledge that is practical and hard to get unless you know these people. This is exactly why we're doing 1 million by 1 million. You know, I grew up in Silicon Valley. Not grew up as in 0 to 18. I went to college. Grew up in India from a developmental point of view, but in terms of growing up professionally, I grew up in Silicon Valley. And you know, because I went to MIT and I used the MIT alumni network and so forth to really build deep relationships within Silicon Valley and got to know a lot of people. But most people who come into Silicon Valley knew it's not an easy place to penetrate. It takes years to build relationships. So you will not really have a chance to sit down with most of the people, the kinds of people that we have brought on this platform, and giving you an opportunity to get to know their journeys and how they have become successful. So that's, you know, essentially my input to you is that learn from them, because there aren't that many other ways that you can access getting into the heads of these people. Okay, Bipin Gajviye is saying he's from Redwood City, California, work at Oracle, interested in making a submission for the Oracle 1M1M Entrepreneurship Program. These roundtables are really helpful. All right, Bipin, we will look forward to your application. And Karen Weather says, not stealth, just that my partner is not on board with this methodology. That's fine. It's your company, you can do exactly as you please. This is why we become entrepreneurs, so that we can do exactly as we please. All right. So I think we're going to adjourn at this point. Come to the next session, come to the rendezvous, and I look forward to working with many more of you through these programs. And good luck in making lots of progress meanwhile. Bye-bye.